like it's become a continuum. Okay, so my name is Elizabeth Stevens. I am a sales executive at Allen Press. By day, by free time, I got the opportunity to serve as an equity impact advisor for Douglas County Unified Command during COVID. So public health has always been something that I took for granted, or maybe didn't have a clear understanding of what it was and what the intentions or why it was there. I think with a lot of things, the pandemic really highlighted disparities that were already there and exacerbated those. My involvement as an EIA, I was fortunate enough to serve with an incredible group of people who really brought a lot of richness to the work, a clear understanding of what the goal is and how we get there. My view of public health changed a bit, and I saw there's some folks here that aren't being taken into consideration. There's some folks whose voices aren't heard. I got to be part of a team that addressed some of those issues and started to speak up for those who typically were muted.
So my name is Bradfield, so I'm the Vice President of Ancillary and Support Services here at LMH Health. I think my role in engaging with the Douglas County Health Department was related to COVID, specifically around vaccinations and COVID testing. Big clinic we did at the fairgrounds and also with the testing amongst the community. LMH Health was the launch of the KU faculty when it first started the COVID testing, and then we branched into doing the community testing with the saliva PCR test kits that were purchased with federal funds. And launched that, working with several of the staff members and leaders at the health department to get that initiative through the community, and branching out into Baldwin and Eudora and Lecompton and some outside facilities. So I think it's probably not well known in the community what public health actually is here for and what they represent. I mean, it's kind of interesting in the engagement with the vaccinations that's one of the things that they're known for is epidemics and pandemics and launching vaccinations, and they've done that before in other care scares that they've launched other initiatives. So I don't think it's a new paradigm for them, but I don't think people understand their ability to kind of ramp up when they need to, and I think their skill set in organizing those type of initiatives. I was very impressed with that. Either people probably don't either know how much work was behind scenes or how many people were behind scenes kind of collaborating and getting that work done. It's something that a lot of people are used to, but trying to do that across multiple organizations is not an easy task. And to get everyone to come together and work in a unified manner, is underestimated within our community, but also showed the resilience of our community to work together and accomplish a common goal. And the amount of vaccinations we were able to accomplish in a short period of time was nothing short of impressive.
My name is Joe Heidrich. I'm the Associate Dean at the KU School of Pharmacy. The KU School of Pharmacy has been involved in vaccination efforts for a long time with the county, and obviously when mass vaccination opportunities for the COVID-19 pandemic became a reality, we were ready to jump in with both feet. When we got involved, it was January 29th, I believe, was the very first one. It was a cold morning. The first clinic, I think in 8 hours, I think we did around 600 or 700. By the last clinic, I'm pretty sure we were doing 600 or 700 per hour. And so that tells you how much we learned along the way. For me, honestly, it came down to efficiency. But I think also the most important thing for me is I knew from the very beginning in the very first clinic that this project would not be sustainable if we didn't try to make it fun. And I think that is what our goal at the School of Pharmacy and my goal personally is that it was hard work, and everybody that came in needed to come in with a mindset that this is going to be fun, and we tried to do that. We played music, we danced, and we didn't take ourselves too seriously. I think that was a positive impact on the events to make sure that we're all here for the right reasons, but we're not here working for anybody. This isn't a typical healthcare environment where there are already misconceptions and barriers you have to break down. We're coming in here and we're going to have fun and we're going to vaccinate the entire county. And I think that was probably the biggest thing for me to make it sustainable for the entire 3 months that we did it. I invited as many volunteers as I possibly could, not only because we needed help, because I wanted people to experience it and I wanted them to see what it was like to see an entire community, an entire county pull together. Yeah, I mean, for me to be the representative for the School of Pharmacy to receive this award, it's kind of difficult for me to receive this award, to be honest with you, because if you were at any of those clinics, you know that there are thousands of people that deserve this award just as much at the KU School of Pharmacy. But we are truly humbled and honored to be thought of and be even mentioned in some of the same sentences as a lot of the people that worked on this project.
One of the things I learned, one of the silver linings of the pandemic has been the ability for our community to come together. There's been a lot of people that has assisted in different initiatives, from testing to vaccination to supporting other initiatives within those initiatives. One of the things you think of, like the Restaurant Association helping out with delivering lunches out to the fairgrounds for over 200 people. You think the Senior Resource Center helped out quite a bit with the call center at KU. So definitely surprised and humbled by it, and definitely appreciate the award.
So this work has never been about recognition or accolades or anything for me. And I feel like I can safely say for any member of the EIAs. So it's a weird feeling because that's not what the work is about. And also this was a team effort. So we had some really amazing folks. We had Alex Kimball Williams, Erica Hill, Dr. Janika Moore, Ruwa Hasabala Muhammad, Ferris Mohammed, Paula Smith, Jasmine Moore, some truly phenomenal people who shaped and molded the work, and who did a phenomenal job at fearlessly speaking up in spaces that we aren't typically heard. So it's definitely a weird thing to be recognized for being part of a group. I feel like the group should be here because it's never just our voice is heard when we're together. We're louder when we're one.